Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. Through my work here at Startup Health and this podcast, I've gotten the privilege of interviewing many founders who are working on solutions to Alzheimer's disease and related dementias. There's a thread that binds them all. Pretty much to a person, they've been touched by the disease. A mother, father, husband, wife, sister, brother. They've watched a loved one deteriorate. They've watched them lose themselves. And then they've decided to try and do something about it so someone else doesn't have to go through that with their family. That brings me to today's guest, Meryl Comer. Today, Alzheimer's disease has entered the public consciousness. That wasn't the case in the early 2000s when Meryl learned that her husband had early onset Alzheimer's. Meryl put her career as an award-winning journalist on hold to care for her husband. Years later, she chronicled that experience in the book, Slow Dancing with a Stranger. It's a raw testimony to the cruelty of Alzheimer's disease, but it's just as much about the incredible emotional and physical toll of daily caregiving. Like many of the founders we work with in our Alzheimer's Moonshot, Meryl Comer found hope in her ability to take action.
Advocacy saved my life.
Over the last few decades, Meryl Comer co-founded the organization UsAgainstAlzheimers and served as the CEO of the Jeffrey Bean Foundation Alzheimer's Initiative. She also served on the NIH National Advisory Council on Aging. Last but not least, we're proud to have Meryl Comer as part of Startup Health's Alzheimer's Moonshot Impact Board. In our interview, Meryl helps us anchor Alzheimer's innovation in the realities of caregiving.
We're at an innovation inflection point, but the advocacy has to catch up.
She also gives an important perspective on the role of Alzheimer's policymaking and what needs to happen for our society to destigmatize diagnosis of this disease and finally treat the problem at the source. Let's get into it. You know, reading your biography, you've had decades of experience in the Alzheimer's field. In fact, on one of the websites I was reading, you wrote, it's hard to believe that it's been as long as it has, multiple decades in Alzheimer's. And you've worked with Us Against Alzheimer's, the Jeffrey Bean Foundation, NIH National Advisory Council. When folks have a CV like yours, I often like to ask them, how do you like to introduce yourself? What experience kind of resonates with who you are, and how do you like to present this sort of body of work?
Everyone has a personal journey. You start out in one space, and unfortunately, in too many cases, across diseases, it interrupts life. And I think I didn't know the disease. I had never heard Alzheimer's. I was a journalist. Shame on me. But back in that time, there was such stigma around a disease that I didn't know. And so my journey began with my husband's illness and trying to fix a disease for which there is no cure or no fix right now.
Yeah.
And
when was that? I know you wrote an entire book about this experience.
Well, the book was written in 2016, and that was almost 20 years into the disease.
Okay.
I had vowed, you'll be amused, Logan, as a journalist, I vowed never to write a book because I had interviewed so many people with nothing to say. So I said, okay.
I hear that.
But I was so angered by how Alzheimer's was portrayed as a little old lady who couldn't remember her address when it's the cruelest of diseases, that I said, all right, I'm going to write a book on public policy and tell a bit of my story. The publisher said, Comer, just tell your story.
Okay.
So it was a very unvarnished story. But I've been in this space now for, I'm embarrassed to say, 30 years in the space as an advocate. And I will say that advocacy saved my life.
Okay. What do you mean by that?
Because when you take care of a loved one with a disease, and my husband was chief of HEMOC at NIH, a brilliant mind that I watch unravel and try to take care of. No matter what I did, and they said he would only last for 5 years. And the Girl Scout in me left my work to take care of him. He lasted 24 years. And no matter what I did, the disease would win. That's very hard in an environment when someone is losing control at many different levels across the journey.
Yeah.
And being an advocate, in my mind, leveled the playing field a bit.
Okay.
I could fight the disease in a different level. And that to me was the way I would save myself. Otherwise, you get lost or taken down by the disease. My book is called Slow Dancing with the Stranger. So the disease was the stranger, and my husband was becoming the stranger.
Got it. So speaking of advocacy, I know you worked on a strategic plan to help Congress kind of understand and think about its plans for Alzheimer's. Where do you feel like we are right now in terms of those policies that you worked on and our sort of readiness for this disease at a more federal level?
Well, through advocacy, we have certainly increased the dollars spent at NIH on Alzheimer's research, now into the billions, and earlier, just go back a decade or so, it was in the millions on this disease. It has the stigma not only of the disease itself, but who gets it? Older people. So there are two strikes against it as a disease, unfortunately.
Yeah.
And now I'm of that age, and I think we have to change the paradigm a bit.
Yeah.
But the dollars are always vulnerable, and it's how those dollars get spent. And what is interesting is that 2/3 of the victims of Alzheimer's disease are women, and we're 2/3 the caregivers. So we're disproportionately impacted by the disease. And that really deserves attention, to begin to tease out the difference between men and women. So I'll give you a few examples. If the disease is in your family on the maternal side, your risk profile is higher.
Okay.
All right. Women hide out better in the disease than men because we're verbal. So what happens is we hide out longer, but then our drop in the disease is more precipitous than men. So they're beginning to tease out differences. So we do much better on the MOCA tests that are the classic psychological tests around the disease than men might do. But this is new, believe it or not. This is not old information. This is information we're just getting to.
Interesting.
In this process. But I've always been about, when I ran the Jeffrey Bean Foundation, always focused, because I lived in the disease with both my husband and my mother, that we needed to go earlier in the disease. We couldn't wait.
Yeah.
Can't fix it later.
Well, that's a good segue to some of the innovations that are in the market now and that we're seeing through Startup Health's Alzheimer's Moonshot. I'm new to this field. Maybe it's been a year and a half that I've been writing about and working with these founders. It feels to me like we're in a very special moment and that there's an acceleration of innovation in terms of the ability to detect it early by various means, sort of a multimodal approach to detection, understand the progression of the disease using AI, and then even therapeutics. So I guess my first question is, given your vantage point, are we at a special moment, or are we just, is it one of those situations where I'm just paying more attention because here we're doing this Alzheimer's Moonshot, or there's just more money coming in and so we're just seeing more of it? Or are we actually at an innovation inflection point?
We're at an innovation inflection point, but the advocacy has to catch up.
What do you mean?
And the issues around it. There is still stigma. You have a community that is focused on early diagnostics. And now the science is actually moving earlier in the disease to interrupt it. So you see the innovation and the science beginning to coalesce. But the issues around the disease, the payer issues, the stigma is not gone. It just moves earlier. So who are you talking about? If you
Mm,
diagnose earlier, you're talking about people in their prime.
mm,
Well, what does that mean? It means insurers may reject you. It means that you may be marginalized professionally. So there are these competing dynamics. Here goes the innovation,
mm.
and where's the catch up?
Interesting.
And that to me is where it's a very tricky, it's an exciting space in terms of the innovation.
Yeah.
But do I want to be told now, 8 years before I ever get symptoms, that I have the disease? The reality is the disease starts 20 years before first symptoms.
Yeah.
So the science is pushing get to it earlier to slow disease progression. We do not have a therapy that guarantees remission. We have a therapy right now, we have several in the market that may slow disease progression, but for only a short window of time. You are buying time right now with any disease modifying therapy. And there are a
What?
lot of people out there, by the way, who say, you know what? I don't want to know.
Yeah.
I'm not taking that test. They may have the test. I'm not taking it. Well, if you believe, as I do, that knowledge is power, rather than wait to be a victim, I'd go for I go for knowledge, right?
Yeah.
I go for that information because then it helps you determine how you want to live your life.
Yeah. Yeah, I think the folks that I've talked to that are doing early diagnostics, they say,
Mhm.
well, of course you'd want to know because there are things, like you said, there are things that can slow the progression. Um, if I had a friend or, of my parents' generation who said, oh, I don't want to know, what would you recommend? If you said, no, you should get tested because you can do X, Y, or Z, what are the things that you would say are the sort of appropriate therapeutic steps for someone who maybe does find out that they are prone to getting Alzheimer's?
If in fact it runs in the family, you are at high risk. There are so many independent risk factors for the disease itself that it's important that you look at all of them. And that's why there's a whole move on brain health and prevention. The World Health Organization says we can prevent 40% of the disease can be prevented. Well, that means no inflammation, cholesterol in check, obesity.
Yeah.
I mean, this is the new mindset of how you can transform yourself. So that's the third, the third leg of what people are now trying to do. So I actually opened my results of my test, genetic testing, live to camera
Okay.
on Nightline
Really? When
with
was this?
with Terry Moran in
Okay.
2016.
Okay. Tell me
I,
about that.
well, Terry Moran is one of six children. His mother got early onset. And he came to me and said, is there a family you might think we should interview? And I said, Terry, you have to push the envelope. I said, go for the knowing your numbers, knowing where you are. And I said, you do it, I'll do it. I ended up opening my results live. I thought I was going to drop dead of a heart attack for the 24/7 care that I was giving to my husband and
Right.
my mother.
Right.
And then I found out that I was a 3-4, which means that I'm a higher risk profile.
Okay.
It also means that you need to know your numbers because both of the disease modifying therapies that are right now on the market, I'm not eligible for.
Okay.
I wouldn't have known if I hadn't known my numbers. So I call it knowing your numbers, the checkup from the neck up, we used to call it.
So how did you decide? Did you decide to live your life any differently after learning those numbers?
I think it forces you to evaluate how you live your life, choices that you make. I'm of a generation that just worked. I'm not a generation of the young investigators who want balance in their life, right? But I think it does. It changes your planning and how you look at life. And my husband maintained his brain, right? He was a long distance runner, spoke 4 languages, 200 published research papers in prestigious journals. It didn't matter.
Hmm.
He was 57 when he was diagnosed.
Wow.
So I know what a diagnosis in your prime looks like and what the costs are. So knowing what I know, I'm a woman with 2 long-term care policies, which, by the way, they no longer write because the actuarial tables didn't project people living that long with the disease.
Gotcha.
Okay. So this is a very fluid time to be in this space, but a critical time. We have to stop this disease. I don't want my children doing for me what I did for my husband and my mother with love. I don't want to be remembered that way.
Sure. Earlier this week, I was interviewing the folks from a company called Minder, and they are taking the results of, I think it's called the Finger trial, out of Finland, that really kind of mapped out these 5 or 6 key areas that if you worked, and they sound elegantly simple, so your diet, your exercise, your social connection, a couple others, that you're able to dramatically reduce your progression from mild cognitive impairment to dementia or Alzheimer's. So I'm kind of curious, like, do you think through some of these categories and sort of, carefully think about your social connections and think about your diet as it pertains to your brain, just given your experience?
I track all the latest on the worldwide finger studies.
Yeah.
I know the scientists involved in the research. My philosophy is I'm doing all of it until the science catches up.
Okay. What do you mean by that?
It's all we have. Let's
Yeah.
be honest. It's exactly what we have. So I've upped the number of miles I walk. I'm wired up for science.
Yeah.
You wire me up, I'm a candidate, right? And I think that they miss an opportunity with people who have seen the disease up close. And
Interesting.
what I mean by that is that if you've seen the disease, you're changed forever. And what is fascinating to me is among many of the young companies in the Alzheimer's moonshot community, it's driven by a personal pain or relationship to the disease. And there's a helplessness about that because these are young investigators and entrepreneurs. And they probably saw it in their grandparents and were so appalled. When a grandparent says, "Who are you?" it's devastating.
Yeah.
So I think it drives people in really most productive ways, unfortunately. But there's a lot to get done. But you see all the confluence of all these
Yeah.
competing dynamics. So it's complex.
In
Like
my
you say,
experience, in my experience, 9 out of 10 of these founders has been driven by a personal family experience. What I often tell people is that what's so unique about that within Alzheimer's, but also within healthcare, is that gives you a tenacity that other founders just will not have. If you're just making a widget, a better mousetrap, if you're just, building whatever, the road gets rough and why should you stay in? But if you're creating an answer for the devastation of your youth with your own family, then you're gonna have the stamina to keep going, which is what you need.
Yeah, I was one of the first women in business news many years ago. And when I did the special series with these CEOs, I always looked at their nonprofit affiliations because that told me where their personal pain was.
Mm,
And that's always part of someone's story.
yeah, very interesting. Talk to me about, okay, so you said caregivers have a lens on this disease. Their lives have been completely changed. And so we need to sort of tap into their experience. How can we help them more? I look at the Alzheimer's moonshot, and it's all about therapeutics. It's all about early detection. What are some ways that you think founders should be thinking differently about helping caregivers and just making life better now, in addition to all the future looking sort of therapeutic work?
Well, first of all, I have great respect for Zinnia, one of the companies.
Yeah.
Let's come out and try to be adaptive and make life easier for both the patient and the caregiver in the space they share.
That's for our listeners, that's the therapeutic TV, so that someone with advanced dementia or Alzheimer's can watch something that's been created especially for them, with the colors and the speed and the plot, taking their brain state into account. Correct?
It's designed to also modulate anxiety,
That's right.
which is really very critical. In fact, behavior or inappropriate behaviors and agitation is one of the first triggers that ends up institutionalizing people. So it is much more important to see how you stabilize people on a day-to-day basis. So
Yeah.
it's not just let's watch television together.
Yeah.
This is strategically designed to focus on an area that is a real issue. I would rather I used to walk my husband 6 miles a day to prevent sundowning
Mhm.
rather than give him a medication.
Yeah.
So there are always trade-offs in this disease. But I think the work is fascinating. Listening to the uh, young entrepreneurs and what they're working in, the ability through an eye exam to actually be able to identify the disease early on, 8 or 9 years out.
Yeah.
We should not. So what does it say to me as an advocate? Don't burden the ophthalmologist with trying to educate people about Alzheimer's disease. Make it one more test in the annual checkup that you get with your eyes, ordered by your doctor, your physician, because it's how you get these innovations into a system.
Yeah.
But you may have an eye issue, but it's not as burdensome as the idea that you're going to lose your mind, right? On a
Yeah. Yeah.
comparative basis.
No, it's
Where are the entry points? Where can it be deployed?
and have you heard much about these voice biomarkers that can detect Alzheimer's through something as simple as an Alexa or Siri analyzing your voice as you answer a series of key questions? What really sort of intrigues me is the idea of a true multifaceted, multimodal approach where your voice biomarkers, your eye exam, your blood biomarkers, they're all brought together into what would appear to be a very 365, 360 degree look at your risk.
You have just encapsulated what's going on. And my point is that where's the hope?
Mm,
Where is the science? The science has to catch up.
yeah. And you said the policy, things like insurance, things like workplace policies, how people are handled when they get the diagnosis. Are they pushed out the door? We're already seeing ageism in the workplace. This would just add one more layer. A employer would want to know, would be curious about your test results.
You're marginalized. You're not, if you were in a position of any authority,
Mm,
you are marginalized. I tried when I was head of the Jeffrey Bean Foundation Alzheimer's Initiative to get them at Mayo to make it part of an executive workup, and they wouldn't touch it.
interesting. Okay. No one wants to know.
But I will tell you, there will come a day when it will be a fiduciary responsibility of boards, and CEOs will have to have a cognitive assessment workup on an annualized basis.
So interesting because I keep hearing about these tools that can really slow the progression. So it's a choice to not know at the risk of full progression when there are these things. I'm convinced that folks don't quite know how many tools are out there that can slow the progression.
Well, your tool, most of the innovation is coming in diagnostics,
Uh-huh.
not in tools to slow the science. The pharma side is looking at slowing disease progression.
I'm thinking more about tools like Moneta Health that we just wrote about, where it's cognitive rehab therapy over the phone, which they've had great success with, like PT for the brain, and then things like Minder, the finger study. So apps that kind of take you through these kind of basic things, but have been shown to slow the progression. I'm convinced a lot of people don't know that those tools are out there.
I agree. I agree. But most of them, too, are paid for out of pocket.
That's right.
It's not reimbursable.
Yeah.
So,
Now, Moneta Health is now covered by Medicare, so there have been some changes, and hopefully that can increase. They're going
but
state by
what are
state.
the parameters, though, for that particular company, since you seem to know it? Is it for trauma? Is it for Alzheimer's?
It's for mild cognitive impairment. It's for
Well,
MC.
you have to know that you have MCI,
That's
right?
right. That's right. So you have to go into the doctor. The doctor has to give you that diagnosis before you can start and get it reimbursed.
And you walk in, and in 10 minutes, there is no way the doctor is going to diagnose my MCI or feel
Hmm.
comfortable.
Because it's going to start you on, it could get you fired. Like, why? The stigma?
I have been in a cardiologist's office, and I said to him, "Well, what do you see?" He said, "Well, I see it, but I don't want to tell my patients. I don't want to depress them."
Really?
Enough. Yes.
Really?
So the doctor, I say, get rid of paternalism in medicine, please. Just tell it like it is.
Yeah.
In this day and age, these are data points we all need to know.
You said knowledge is power earlier.
And financial, by the way, the financial companies, because of liability, are now being sued, where they say, how did you let my father make that $100,000 investment
Mm,
when he's obviously not all there?
mm, interesting.
So they are now being more careful about how they manage because it's very subtle. You cannot you cannot confront somebody. Maybe somebody's having a bad day, right?
Yeah.
But you have to listen. I unfortunately know the disease too well, and when I walk in a room or at an event and just listen to conversations or in a group, you can pick it up.
Mm,
But am I going to confront them? No, I'm not going to confront them.
you're bringing up such a interesting range of challenges that are outside the world of sort of
I'm sorry, but
entrepreneurship and the founders, but it makes me wonder, like, where are those issues going to be worked out and how? You do your advocacy work through Us Against Alzheimer's. Where do we need to be waging this battle for more open conversations, more candid conversations with physicians? Like, I guess like a closing question for you is like next steps. How can people listening to this conversation help move the ball forward?
I think they have to go to their physicians and request the test.
Hmm.
You want to know. They'll have to bring it up. The doctors will not be proactive. These are statistics that I'm not making up. It takes around 15 years for things to really get through the cycle where doctors feel comfortable in recommending it.
Got it.
So it's going to be incumbent upon individuals to say, I need to know my numbers. I need to know where I am.
So
For myself or my family.
advocate for yourself and your family. Get to know your numbers. So be proactive with your physician. And then you have to get proactive with understanding the solutions that are available, because no one's going to just hand that to you either, are they?
The doctors are not handing that to you.
So whether it's Moneta or Mind or any of these apps, any finger study, any of the things that can slow currently, you have to go out and advocate for yourself.
And then be aware that they exist, which is what you do so well in sort of showcasing many of the entrepreneurs in the Alzheimer's moonshot community.
Yeah.
And you need people who are willing to step up and test it.
Mm.
I mean, this is a very different world, whether it's the world of politics. This is a social media world, right?
Yeah.
This is how you slice and dice it, the information. So
Yeah.
I think it's word of mouth. And I think that when kids come home from college, the prescriptions for Aricept, which is one of the old-time early disease symptomatic treatments that are available,
Mm-hmm.
prescription numbers go up
Mm.
because they're the ones that say, hey, what's wrong with dad or mom or grandpa?
Yeah.
So it's awareness.
Interesting. You're saying the second generation, not even the adult parents who are caring. It's the kids coming
Yes.
home from college. Very interesting. So then you're going to see a shift as even Gen Z starts to have their own thoughts and feelings about Alzheimer's.
Trust me, I went for Gen Z, which is why I'm an advocate. I want to know their numbers from the very beginning. If we are testing young people for sports at age 14 in schools, why aren't we all being tested?
Mm.
Why isn't that just one more number we're handed? Because if we're trying to go earlier, how much earlier can we get
Mm.
in the system?
And you're talking about numbers that are going to give you a sense of your likelihood or your higher.
Just beginning to track those numbers early on. I will tell you that I've met more men in their 50s whose fathers had the disease. They are the quantified selves. They have spreadsheets on themselves, on their workouts, on their cholesterol, on all of their numbers. Trust me.
Mm-hmm.
Because once you've seen it, you're changed forever.
Yeah.
And they are determined to make sure that they're not going to get it.
Yeah.
They're trying to move the odds, right?
Yeah. It's very interesting. Very interesting. Thinking about the multiple generations and how each generation is going to have their own view on Alzheimer's and how that's going to change our societal attitudes is interesting. And I think, we've started to put some of our information about these companies on TikTok. And I think having younger people start thinking about some of these issues will put pressure on their parents, on their parents. And it could even be their great their grandparents who they're
Well,
concerned
have you seen this, right?
about. Yeah, exactly.
They're the ones that take the information. They push it forward. It was the kids it was children in school who changed smoking.
Oh, interesting.
So go early. I don't want the Gen Z
Yeah.
age population. I don't want my grandchildren, although they're older than Gen Z, to be in that situation.
Yeah.
I want that term off the table. Okay. Because what you're going to find, the future is really about mixed dementias. You can't program just to one dementia because many times people have what they call mixed dementias.
Okay.
So again, it's the brain, right?
Yeah.
And it's idiosyncratic to individuals. So we're all different. The one advice I will make for you, for your young entrepreneurs who are doing all these charts to help caregivers and everything, they have no clue to what we do every day. If it takes an hour and a half to bathe a loved one who is fighting you all the way, or another hour to dress them, what they're asking is too much of us. It may look very neat and programmed, but we're not going to be able to do it. We don't have the time. So being sensitive to the environment or being alert about what they're programming for is something, otherwise the shelf life of their product doesn't adapt with the disease. So that's a wake-up call.
Yeah. Well, I appreciate you leaving us with that wake-up call. Meryl Comer, really appreciate you taking the time with me today. I feel like I've learned a lot. I've been in kind of my zone of learning about innovation and these founders, and I feel like you kind of helped me pull back and really see the whole industry and the advocacy piece and the caregiver piece. So I appreciate that.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.